Today, we're digging into a disease that sounds like it belongs in a history book, tuberculosis. But here's the thing. While it might be an ancient enemy, it is far from defeated. In fact, in some ways, we're actually losing ground. So let's get into why this old foe is still such a modern threat.
So let's just ask it right up front. Is tuberculosis a thing of the past? The short answer is a hard no. Not even close. While it's definitely not the killer it once was in many parts of the world, our progress against it has started to stall, and it is still a massive global health problem. To really understand why it's so persistent, you gotta know your enemy. So what exactly is tuberculosis?
Okay, so at its most basic level, tuberculosis, or TB for short, is caused by this one little bacterium, Mycobacterium tuberculosis. And yeah, we almost always think of it as a lung disease, but what's really wild is that it can spread pretty much anywhere in your body. We're talking kidneys, the brain, even your bones.
This bacterium is a seriously tough customer. It spreads through the air when someone coughs or sneezes, but get this, it can survive for months in the dark. It's got a mortal enemy though, sunlight. A few hours of direct sun will kill it. And in the lab, it's got this cool superpower. It's called an acid-fast bacillus, which just means it has this waxy coat that holds on to dye, even when you try to wash it out with acid. It makes it stand out under a microscope.
Now that toughness is really the key to the whole story, and it brings us to what is, without a doubt, the single most important concept to grasp about TB, the huge difference between being infected and being actively sick. The best way to think about it is like there's a sleeper agent hiding inside your body.
So here's how that sleeper agent idea plays out. On one side, you have latent TB. That's our sleeper agent. The bacteria are in your body, but they're dormant, walled off by your immune system. You feel fine, you have zero symptoms, and you can't spread it to anyone. But then you have active TB, the active threat. This is when the agent gets activated. The bacteria start multiplying like crazy, your immune system gets overwhelmed, you start feeling sick with a cough and fever, and now you're contagious.
So how does your body put this sleeper agent on lockdown? Well, first you breathe it in. Then your immune system does something incredible. It basically builds a microscopic prison wall of cells around the bacteria. This little prison is called a tubercle. Inside that wall, the bacteria are forced into a dormant state. But, and this is a big but, that risk is always there. If your immune system ever gets weakened, that sleeper agent can break out.
Now here's the crazy part. Most people who get infected never actually get sick. Here in the United States, only about 5 to 10% of people with that latent infection will ever develop active TB in their entire life. For almost everyone else, their immune system keeps that agent locked down forever.
So that leads to the obvious question, right? If most people's bodies can handle it, what wakes up the sleeper agent? What are the triggers that flip the switch from a harmless latent infection to a dangerous active one?
Well, it all comes down to one thing: a weakened immune system. Anything that compromises your body's defenses can be a trigger. Things like getting older, having a condition like HIV/AIDS, or taking certain medications that suppress your immune system. Substance abuse also plays a big role, and really importantly, your environment matters. Living in crowded places like prisons, nursing homes, or shelters puts you at a much higher risk.
And this is where the story gets a lot bigger than just biology. It reveals a really stark truth about health inequality in the US. A staggering 88% of all TB cases happen in racial and ethnic minority groups. This just goes to show that vulnerability isn't just about germs. It's deeply connected to social and economic factors that affect everything from living conditions to access to healthcare. Okay, so we've got a handle on what TB is and who's most at risk. But how in the world do you find this hidden threat, especially when it's in that silent, sleeper stage?
Seriously, how do you find a sleeper agent? You can't look for symptoms because there aren't any. You have to find a test that can see the memory of the fight, the footprint the bacteria left on your immune system.
And that test is one that a lot of us know well, the PPD skin test. Come on, you know the one. If you've ever worked in a hospital or maybe even just for a school physical, you've probably had that little needle prick in your forearm.
So the way it works is actually pretty simple. They inject a tiny bit of protein from the TB bacteria under your skin. Then you wait for 2 or 3 days. And here's the pro tip, the part everyone gets wrong. The person checking it can't just look at it. Redness doesn't mean anything. They have to physically touch your arm and feel for a hard, raised bump. That bump is called an induration.
But here's where it gets interesting. What counts as a positive test isn't the same for everyone. It's all about your personal risk. You can see here, for someone with a really weak immune system, like a patient with HIV, even a tiny 5 mm bump is considered positive. But for a totally healthy person with no known risks, you'd need a much bigger bump, 15 millimeters or more, to call it positive. It's all about context.
Okay, I need everyone to listen to this part because it is the biggest point of confusion. A positive skin test does not, I repeat, not mean you have active contagious TB. All it means is that at some point in your life, your immune system met the TB bacteria and learned how to fight it. That's it. To see if you have an active disease, you'd need more tests, like a chest x-ray.
So, once we find TB, whether it's the sleeper agent or the active threat, how do we fight back? Well, the good news is we have some really powerful ways to treat and prevent it.
The treatment is incredibly effective, but there's a catch. It requires a serious commitment. We're talking about taking multiple different antibiotics every single day for 6 to 9 months. And finishing that entire course is everything.
And here's exactly why. If someone stops taking their pills early just because they feel better, they haven't actually killed off all the bacteria. The ones that are left are the toughest of the tough. They survive, they multiply, and they can learn to resist our drugs. That is how we create multi-drug-resistant TB, or MDR-TB, which is an absolute nightmare to treat.
So how do you solve a problem like that? Well, public health officials came up with a brilliantly simple and effective strategy. It's called Directly Observed Therapy, or DOT. It's exactly what it sounds like. A healthcare worker literally meets with the patient and watches them swallow every single dose of their medicine. It ensures the treatment gets finished, period.
And inside hospitals, preventing the spread is like a military operation. Patients with active TB go into special isolation rooms that suck air out of the building. Staff have to wear these heavy-duty certified respirators. A regular surgical mask won't cut it. And if the patient has to leave their room for any reason, they've got to wear a mask to keep their germs to themselves.
And look, don't just take my word for how well DOT works. The World Health Organization themselves say that this simple, hands-on approach gives us the highest success rates in treating TB anywhere in the world. It is one of our best weapons. And that brings us right back to the beginning. We have the science, we have the tools to find and cure TB. But with our progress against it slowing down, the real question now is, how can we get more aggressive about finding and treating all those millions of sleeper agents, all that latent TB out there, so we can finally corner this ancient enemy and make it a true thing of the past?